Let me say a few words on this. So we're at hospice. Whoever it is that we're thinking of is in the bed. The final minutes. The doctor's there. So I'll need your help remembering this. The doctor, the priest, the family member, the, anesthesiologist, the pain person, whatever, I don't know, whatever they're called, the person, pain medicine person, the nurse, and maybe the janitor, somebody that comes in to help clean things or bring supplies. Let's just say 6, just for everybody in there is helping this person's process. I could have said we're in the birth room in the hospital, same thing. All these people are there, but I chose hospice. Doesn't matter. We both know all those 6 people, maybe it's 30 people, whatever, they're all there to do what they do. Imagine that the doctor looks at these 5 people and says, none of these people are doing what needs to be done. I'm doing what needs to be done, and they do their doctor things, whatever that might be. And then the priest looks at the other 5 people and says, none of these people are doing what needs to be done. I can't believe it. And then the priest does what the priest is there to do, the holding the hand and the praying. And then the family member, the child, the husband, the mother, whatever, they're looking, none of these people are doing what needs to be done. And then the family member brings their favorite fruit cake so they can smell it as they pass away, or whatever they do. Going on and on and on. The janitor comes in and is like, nobody knows that clean, warm bed sheets make all the difference, and getting away the stinky sheets is really helpful, makes and brings in the flowers or something. None of these people are doing what needs to be done. And of course it's true that everybody's doing what needs to be done to their abilities, given what they are trained in, what they value, what they can do well. And so it's unhelpful for any of them to spend time thinking what the other people are not doing, instead of saying, now of course one of the people in there could have just been, a vagrant, just walked in and stood there and they're in the way and they don't know the person, they have no skill. I suppose that's possible, but better for us all just assume, I don't know why their ex-mother-in-law is in here, they've argued with him for 30 years, but the ex-mother-in-law is here. I'm going to assume there's a good reason that person's here. I don't know why they need an anesthesiologist. The patient said they didn't have pain as far as I know, but the anesthesiologist is here. So I'm going to assume that there's a reason. And I think we're all going to do better if we assume that everybody that's in that room is there for a reason and they're bringing something that they can bring best in this moment. That might not be actually true, but probably by and large it's true in any of these circumstances. And then that allows us to focus. I might wonder for a moment, why, you're not a Catholic, but you brought a Catholic priest here. I don't know. All right, well, I guess that's who you wanted. I just assume you're doing what you do. Let me focus on what I can do, and that frees me. And that gives me, I'm inviting in the grace to consider everybody else's contributions are coming from their heart, from their skill level, and it's meeting a need that I can't meet. And by the way, I can't make my need best if I'm worried about or somehow distracted by concern by their attempts at offerings or effective offerings or not. So just maybe a metaphor.